Throughout my time practicing as a primary care physician, one of the most common but under-recognized conditions that I personally saw in clinic was iron deficiency, but without the anemia. This condition actually affects about 30 to 50% of women and can actually be very symptomatic, including symptoms like hair loss, fatigue being the most common, dizziness, decreased exercise ability, and even restless leg syndrome. So if this affects so many people, and it's so common, then why is it so underdiagnosed? Well, the primary reason for this all starts with our lab testing. Whenever we're assessing for iron deficiency or low iron levels, we want to make sure that we're looking at least two different lab tests. One of them is the CBC or complete blood count, and the other one, most importantly, is the ferritin level. Now, your complete blood count is really commonly done during things like physicals or screening tests, and this will tell you if you have anemia, meaning that you have a low red blood cell count or a low hemoglobin level, both of which require iron to build within your body. But the blood count doesn't really give you the whole story when it comes to iron deficiency. In fact, you can have a totally normal CBC but still have iron deficiency. This is where the ferritin level comes in. Ferritin is the most sensitive and specific test to evaluate for iron deficiency because it's a reflection of your body's long-term iron storage. Now, most doctors and labs in the US consider a ferritin level of 15 or lower to indicate iron deficiency or low iron, and a lot of clinics and labs still stick to this value. However, more recent studies, particularly in women, provide really strong evidence as to why we should really consider increasing that minimum ferritin level for iron deficiency from 15 to 50 in order to better relieve symptoms of iron deficiency and restore iron stores within the bone marrow. And this is even further supported by the changes that we see in the GI tract in terms of iron absorption. And then coincidentally, this same ferritin level of 50 was also the common threshold for when people began to experience relief of their iron deficiency symptoms. Despite this clinical evidence, way too many labs and doctors still use way too low of a reference range for ferritin to accurately diagnose and treat iron deficiency, which unfortunately leaves a lot of people untreated and still symptomatic. And I'm really hoping this changes with further spread of this information. If you enjoyed this video, consider following for more and check out my next video where we discuss how to treat iron deficiency.